Okay, Jim, you can start.
Okay. Hi, good afternoon, everyone. Yeah, my name is Jim, and today I'd like to share the topic on cancer and also talk about Ganoderma as supplement to cancer treatment. Yeah, next. So we have disclaimer first, and all the information contained in this slide are intended for general health information and educational purposes only, and are not intended to be used as a substitute for professional medical advice, treatment, or care. Next. Wait. So first we look at the statistic for breast cancer. We'll look at the breast anatomy. So for breast anatomy, each breast contains 15 to 15 lobes of granular tissue, actually arranged like a petals of a daisy. The lobes are further divided into small lobules that producing milk for breastfeeding. So there are small tubes that actually conduct the milk to a reservoir. Okay, that area reservoir is called the areola. And look at the right side, the side view is the the lobules actually connecting to the duct and then to the milk reservoir area and then towards the nipples. So on the extreme right on the top is a normal cell within the duct itself. So this is a normal. But when it comes to the third picture, if there's a cell that starts growing inside, we actually call it in situ. Okay, this is called ductal in situ because in the duct area. Then you look further down that actually the cell, if it start actually growing out of this ductal area, is actually carcinoma cancer. We will talk about more on this. Next. The overview of this breast cancer is that a cancer that forms in the cell of the breast. And this cancer cell is actually uncontrolled growth in the breast. And it actually started with the cell in the milk producing duct and or in the cell in the granular tissue, which is in the lobule area, or other cell or tissue within the breast. So nowadays, due to early detection and with a new target treatment and better understanding of the disease, surviving rate has increased. The number of deaths is declining. So treatment plans all depends on type, what type of cancer type, and what's the grade, and how big is the size, and what are the stages. Next. Now look at the cancer type. For cancer type, there are two broad types. The first one, as we had just mentioned about in situ, meaning non-invasive type. This is actually the cancer cell actually grow within the duct area or the lobule area, where shown in the diagram. So in the lobule area, it's called lobular carcinoma in situ. So the other one will be carcinoma, ductal carcinoma in situ. As you can see, they are actually growing inside, okay, not out of the tissue. So the next one will be the invasive type, which is they name it as carcinoma type. And this is, for example, in the lobule area, they will have lobular carcinoma. You can see it actually grow from inside out to the outside. And ductal area, they actually also grow out from there, carcinoma, ductal carcinoma. And for these two invasive type, 25% are lobular and 75% are in ductal area. Ductal area is the one that actually producing milk for them to transport the milk to the reservoir area. Yeah, so that is the most common type. Next. Next, we'll look at the receptor status. So for this receptor status is that the cancer cell itself, they will actually, doctor will want to know whether is it a hormone sensitive type or non-hormone sensitive type. So this doctor would like to know because is actually they want to actually see what kind of treatment to provide. So for example, there are 4 types. ER positive is an estrogen receptor positive. PR progesterone receptor positive, and the other one is a HER2 positive, and the last one is the triple negative. So for the first one, estrogen, second one, progesterone. These are two hormone-related sensitive type, meaning that the cancer cell of the layer cancer cell, they're actually very sensitive to this estrogen and progesterone, meaning that this receptor will actually sensitive to this type of hormones. When you have this type of hormone that very active over there with this receptor in the cancer cell, they actually grow faster. So they are very sensitive. That's why they tested positive. As for HER2, it's a kind of protein. So this HER2 positive meaning that this receptor is actually sensitive to this protein type. And this cancer grow and spread faster than the other the hormone type. And the last one is triple negative, meaning they don't have receptor. They don't have hormone receptor, they don't have HER2 receptor, but they actually grow fast. So this is the so-called the worst case. They grow even faster. That's why they say triple negative. As you look at the bottom chart, they actually show that estrogen positive, if you test estrogen positive and the progesterone positive, but HER2 is negative, then the treatment type will be going for hormone treatment only, because it's a hormone positive, ER or PR positive. The next group is whether your estrogen or progesterone is positive or negative. As long as you test the HER2 receptor is positive, it's a protein type, you actually go for chemotherapy and a HER2 targeted treatment. And the characteristic of this is cancer grows faster than the hormone positive type. The last one is the triple negative. That means they don't have any receptor, but the breast cancer cell will still grow. Okay, they can only go for, the option now is only go for the chemotherapy. And this one, this group is under the group of cancer grow aggressively. Next. Next, we look at the tumor grade. So the cancer cell also have 3 grades. Grade 1, 2, 3. Grade 1 is the lowest one. Grade 2, intermediate, and the grade 3 is the highest. Okay, how they know is because when you take the biopsies, they actually go under the scope, they will look at the cancer cell, how they look most likely to a normal cell. When you look close to like a normal cell, meaning that it's a grade 1. This type of grade 1 is grow slower. And for grade 2 means they sort of like in between, whether like less like a normal cell. This one they classify, they grow faster. This is grade 2. And grade 3 is totally different from the normal cell. So this is the group that they grow the fastest. Yeah. So for non-invasive and invasive type, they also have 3 grades. Yeah. Sometimes they will name it as low, intermediate, and high. Yeah, next. So next we look at the cancer stage. So now cancer stages are depending on the tumor size, and now they will look at whether the cancer cell spread to the nearby lymph nodes. As a nearby lymph nodes means that the armpit area. Okay. Then they also determine whether if it spread, how far they spread to. Okay. So for stage 0 and 1, they normally is a non-invasive type. Tumor size is less than 2 cm, and so far there is no spread to nearby lymph nodes. As for stage 2 and 3, as for stage 2 is actually invasive type. Tumor size is already grow to 2 to 5 cm and started to spread to nearby lymph nodes. Stage 3 is invasive type. The tumor has grown above 5 cm and 5 cm in the size, and then it spread to multiple lymph nodes out of the nearby lymph nodes, meaning out of the armpit area. The last one, the stage 4, is actually spread. The cancers already spread to distant organ. So under this group is metastatic cancer. Yeah, next. Now we look at the symptom. So a breast lump or thickening that feel different from the surrounding tissue. Next is a change in the size, shape, and appearance of the breast. So changes to the skin over the breast, such as dimpling, or a newly inverted nipple appear. So peeling, scaling, crusting, and flaking of the pigment area of surrounding the nipple or around the breast skin. So also redness or pitting of the skin over the breast, like look like the skin of an orange. So all these are symptoms through daily check or self-examine. So probably have any of these symptoms, probably have to talk to a doctor and see a doctor. Yeah. As for the causes, now the current understanding of what causes this breast cancer is still not complete. But most of researchers and doctors believe that is a chronic stress play a part. As in World WHO actually mentioned something like stress is the #1 health epidemic of the 21st century. So funny thing is our body, when it comes to stress, they actually trigger a lot of event. Yeah, our response to this stress. But chronic stress will be the so-called health issue that along throughout the whole life. So we have to manage the stress. When you have stress, actually your body actually create a lot of triggering effect. Okay, your gland will create all this hormone to the rest of body, and it also cause some immune system response. So they also found that the study that role of immune system in cancer from tumor starting to the spreading progression. So all this actually based on the understanding of how our body function and the research done. So the next one is on vitamin D deficiency. It could be okay playing a role in this cancer. So vitamin D is actually they find that will have some effect on if it's deficiency, they have some effect of the breast cancer. Okay, and with enough vitamin D, they also able to actually prevent or stop breast cancer cell from growing. Okay, so also have some research based on that, latest evidence and future step. Okay, because now the understanding of all this is still not clear yet. The last one is a family history or genetic disorder. Okay, cancer cell came from a vital gene mutation. Yeah. So what are the risk factors? So the risk factor associated with this is with an increased risk are hormonal. So early onset of menstruation and late age of menopause, and the late age of or no pregnancy. The other one is a hormone replacement. So all these are due to the fact of imbalance of hormone at different stage. So the other one is a lifestyle, obesity, lack of exercise. So obesity is means that your weight gain. Okay, you have fats will be actually more. So you have excess fat. Actually, they actually have produce more of the so-called the insulin and other hormones related. Smoker, drinking alcohol. Alcohol also play a part in the in the so-called hormone imbalance. So you will create more estrogen if you have a consumption of high alcohol. The other one is a family history of breast cancer or uh, age above 50 years old. So all these are related to your hormone change. Yeah, next. How can we prevent it? So for breast cancer, actually, there's a risk reduction. So in the area where early pregnancy, okay. The other one is a longer time in breastfeeding the baby. So meaning that you breastfeeding can actually extend it further to 1 year or more than 1 year for new baby. Next will be going for screening or self-examine. The other one is very good is exercise regularly. Exercise has many benefits. Not only can reduce your weight, okay, regulate your mood, okay. So in general, exercise regular is actually encouraged. And with exercise regularly, actually your weight will actually have a healthy weight and control, and your diet has to be in control also. Next, women with a higher risk, meaning whether you are family history or you have consumed alcohol regularly, all these are in the high risk group. Okay, so regular screening with mammogram. The other one is a preventive medication, meaning they will actually give you estrogen blocking. Okay, so the other last one is a preventive surgery. The famous one would be the actress Angelina Jolie found that because she's in the high risk group on the gene mutation, family history of gene mutation. So she found that she went for the so-called genetic test and found that she got this so-called gene. So she actually went for the surgery before the thing happened. Yeah. So it's preventive surgery. So next. So for diagnose, breast examine, mammogram, breast ultrasound, or they remove a sample, biopsies for testing, and breast MRI. The last one will be genetic testing. Next. So the treatment will generally based on type, the stages, the grade, and the size, and the hormone sensitive. Okay, the first one is surgery, okay, to prevent it from spread. Then radiation therapy, chemotherapy, targeted therapy, and hormone therapy, immunotherapy, and the last one will be supportive palliative care for the last stage. Yeah. So these are the four most common treatment type. Okay, surgery. So surgery, they just cut. Okay, they just remove it. Okay, especially when they have not spread to other area, they will actually go for surgery. But the drawback is the surgery risk. Next will be chemo. So chemo, they will actually give you drugs to treat the cancer. So this will actually kill the cancer, okay, from spreading. But the drawback will be good cell also affected. So another thing is that the side effect may include, okay, vomiting, hair loss, bone marrow suppression, okay, and intestinal wall injury due to the effect of the drug. The third group for therapy will be radiotherapy. So this one will use high energy particle to actually destroy and damage the cancer cell. So radiation treat just the tumor and it is localized. The drawback will be the fatigue and skin change. Last treatment will be on a targeted therapy. So this will be actually the drug, as a specific drug to actually more precise identify to attack the cancer cell. With this is the advantage that little damage to the normal cell, but some new drug can be very costly and also have some side effect. Next. So next we look at the health food. So a good number of health food that feature ability that in regulating our physical constitution and immunity can actually lay the foundation to control the growth of cancer cell. So example, Lingzhi is one of the good health food, has been regarded as the top grade health food in enhancing health. Later we'll talk about more on this Lingzhi. Next. Okay, Lingzhi, in the scientific term, Ganoderma, this is a type of mushroom and fungus that has the healing property, and it has been 2,000 years of history, and because of the health healing property, that actually lead the researcher to actually want to find out why it's so special about this Lingzhi, and they have done 50 years of modern scientific research. Okay, and all this has been documented in the PubMed. And the history of 2000 history of all these good of benefit of this Lingzhi has been documented also in the Chinese history of a 神农本草 and 本草纲目, the oldest medical book in China. Yeah, next. So for Ganoderma on cancer supplement treatment, because of these two components, micromolecular polysaccharide and terpenoid, okay, in this Lingzhi, they actually have all these function and benefit. First, they have four. First, regulating immune system, improve blood circulation. Second one, the third one is enhance liver function. The last one is a remove free radical and antioxidant. So the first one, regulating immune system, is that our immune system cannot be too high, cannot be too low. It need to be in a regulated mode. So first one is the fortified immune defense for cancer prevention, so that they reduce the other one, it will reduce the chance of infection during this treatment. Improve blood circulation. In TCM perspective, smooth flow of blood is actually indicate that qi can actually move around the whole body. It can actually prevent the formation of a lump based on TCM perspective. So for enhanced liver function, it's actually during this period of treatment, okay, chemo drug is very toxic. So you actually liver need to be protected. So for this Lingzhi, they actually prevent the potential side effect of the drug to the liver, okay, with the elevated liver enzyme. The last one is a free radical cause damage to the DNA during this treatment. Yes, next. Okay, Ganoderma assists in cancer treatment. Ganoderma assists in cancer treatment in two approaches. First is to prevent the cancer cell from spreading. Second is to complement the treatment to chemotherapy. How they do it for the first prevention is that they induce apoptosis and to kill cancer cell directly. So apoptosis is a process of the so-called our normal cell that actually do a cell division, and it follow the rule that old cell will be die and replaced by the new cell after division. But for cancer cell, they actually also behave like a normal cell. They actually do cell division, but the only thing is that they didn't actually follow the rule that supposed to die, they die. They actually continue to grow. That's why cancer cell can keep on growing to an exponential size that is in a short period of time. So Ganoderma have this effect to inhibit this so-called cancer cell from growing. Next, once with the control of this cancer cell and kill the cancer cell directly, you actually increase the patient surviving rate. So next, we look at how they complement treatment to chemo and radio. So they by antioxidation and also provide stimulating mechanism such as bone marrow, so-called hematopoietic. So during this treatment period, bone marrow suppression will be one of the side effects from the chemo drug. I would say that this is quite common for them. That's why, as we know, that bone marrow is actually to actually produce more blood cell. So this blood cell, there are three groups. Red blood cell provide oxygen. You have enough red blood cell. Red blood cell, the function is as to bring the oxygen into our body. The other one is a white blood cell. A white blood cell is to fight infection. So the last one is the last one is a pellet. So pellet is to actually so-called to reduce control the bleeding and bruise. So when you have bone marrow suppression, your ability to produce blood cell will be low. Then you will have the risk of anemia, tiredness, and infection. All these will go up, okay, when your bone marrow is suppressed. So Lingzhi is quite good during this treatment period, is that they actually provide stimulating mechanism to actually help to formation to help the bone marrow to do blood cell to produce a blood cell for the body. And during this period also Lingzhi also provide liver protection so that your liver can actually clear away the toxic waste. And that's why with all this effect, they actually reduce the side effect of the chemo and radiotherapy. And all this have been done on the evidence research and published in the so-called the PubMed. And there are total, as of now, there are total about 900 publications on Ganoderma and cancer if you do a Google search. Yeah. Yep. Yeah, next. So now we look at the research and technical paper. So all the researchers have done to actually getting the Ganoderma component to actually work on the cancer cell to see how they can actually prevent the cancer cell from spreading. So in fact, all these are having a very good result. Then the summary is that the tretinoin, this is one of the components that inhibit new vessel formation in a direct manner, meaning that actually once you stop the cancer cell from forming new blood vessel, you actually starve it to death. Because cancer cell is just a normal cell, they actually need a new blood vessel to actually get the nutrient from the blood. So the other one is a polysaccharide, also has the effect in indirect manner, meaning that they actually go about strengthening your immune system, and the immune system will do the duty to actually inhibit the cancer cell vessel formation. So they are actually go by two ways, indirect and direct method. But the research also found that high dose have prominent effect on this tumor. So dosage is play a part also on tumor tissue inhibition. Next. Next is on the research and clinical trial. So this is on the Ganoderma inhibits surviving, growth, and metastasis of HER2 positive breast cancer cell. So this is done by one of the professor in a research center of Chinese herbal medicine at China Medical University. So they actually do an experiment. They found that this Ganoderma component terpenoid can actually inhibit growth of EGFR, which is a growth factor receptor. Okay, it's an epidermal growth factor receptor HER1 and HER2 positive cancer cell. So they also found that it can stop the growth from HER2 positive cancer cell and inhibit EMT type of HER2 cancer cell from spreading. EMT is kind of before they actually spread. This EMT start to it's a kind of a process stage that when you go to EMT is when the breast cancer cells started to actually spread. So during this EMT type is that they actually form it very tiny small. They actually want to actually seep through the blood vessel, go into a bloodstream before spreading. So Ganoderma at this stage is very good to prevent this EMT type from forming. So next is also they found that it increased the sensitivity to chemo drug and reduced the effective minimum chemo dosage use. So PTX, ciplatin, and doxorubicin, these are the three chemo drugs that used for breast cancer. It's also good in regulating the body function and immune system to a normal level. So you need to actually multi-pronged method to fight cancer at this stage. So this is a research done by this professor. Next. It's also a research and clinical trial. So this one is Ganoderma inhibit growth of estrogen positive breast cancer cell. So they also found that Ganoderma luciferin inhibit the spread, the so-called the proliferation of human breast cancer cell by down-regulate of estrogen receptor and the signaling path. So it's able to actually inhibit the so-called the cancer cell from growing under the so-called the lab test using the breast cancer cell. So they actually do two things, is that they able to actually specifically stop the estrogen receptor and at the same time stop the signaling from sending for the estrogen receptor, so that when you have stopping all this, cancer cell will actually stop growing at that stage. So all this research and material extract from the magazine, page 44 to 45. Yeah. Yeah, next. So next is also on research and clinical trial on the Ganoderma effect on triple negative breast cancer. So also have a very good effect because they have done it using the extract to actually inhibit the release of all these IL-8, IL-6, all this under the cancer cell inflammation condition, pro-inflammatory condition. So they actually found that this extract, Ganoderma lucinia extract, significantly reduce the cancer cell migration, okay, over time. So with this extract for the, they have able to actually provide the therapeutic management of this melanoma. It's also one of the cancer type, and human triple negative breast cancer based on the research. So they are very good to stop all this on triple negative hormone and HER2 cancer cell from spreading. Next. Okay, next we'll look at the specifically on Shuang, Ganoderma, and Lingzhi. So double crane or Shuang, double crane is in Taiwan, and Shuang is in so-called this area, we name it as Shuang. It has more than 30 years of research in Lingzhi, and they have their own farming, they do their own production and quality control, and with the so-called distribution also under one umbrella. So Ganoderma product with a rich terpenoid and micromolecule saturate. We have now additional at the 3 new product, which is at the specific different higher content. So all this product has been scientifically approved and certified with the government endorsement. Yeah. Yeah, next. Okay, next we look at the recommended dosage. All this dosage recommended dosage is actually through the many years of experience from the senior leaders who actually so-called help the patient, okay, going through with all this dosage with a better effect. So now we look at on the left side, we have the numbers showing the daily dosage. On the bottom line, we have the stages. So first we look at the prevention. So for prevention, this is recommended for child YK1, okay, and for complement treatment, okay, stage, we actually recommend 60 YK1, or you can take 10 YK2, okay. For YK1 and YK2, they are actually, if you do a comparison, they are actually in different in the so-called the concentration of the so-called the terpenoid and polysaccharide. So equivalent to one YK2 is equivalent to about 6 YK1. So for cancer stage 1 to 2 is 30 YK1 or 5 YK2. Okay. Then for stage 3 and 4, cancer stage 3 and 4 is minimum 120 YK1, and or you can go for minimum 20 YK2. Okay. So 1 year after remission, you can actually start to actually drop to minimum 30 YK1, followed by Second year, third year, after remission, you can take 20 YK1. Further down, you can actually reduce further when come to fourth and fifth year after remission, 15 YK1. And for good news is that after 5-year remission, okay, you can actually go back to a normal 12 YK1 as a maintenance throughout. Yeah. So okay, next we talk about the testimonial. So this is the testimonial in Singapore. It's a lady, Madam Lau, got the stage 3 breast cancer back in 2010. Okay, she found a lump in her breast. So went to see a doctor from Parkway Cancer Center. She actually did a biopsy and found that she got stage 3 breast cancer, 3 cm in size, and type is estrogen positive. So doctor, okay, started with chemo for 25 times of radio, okay, and she started at that time. She started Lingzhi 30 capsule YK1 daily, and continue together with the chemo and radiotherapy. And one thing to note is that she doesn't have any obvious vertical reaction, and when consuming when he first started this Lingzhi. So with the help of this so-called Lingzhi and follow up with a treatment plan from the doctor, she actually didn't see any side effect. Okay, and she continued to work. Okay, continue to work, take the most half-day leave, okay, to see doctor, and then afternoon she went back to work. So even the colleague, okay, in the office also didn't notice that she actually had cancer treatment. So after the chemotherapy and radiotherapy, the lump had reduced, and then actually throughout the treatment plan, she actually followed through with the Lingzhi and a very good recovery. She started to consume also pollen to balance the body hormone, okay, and replace the nutrient needed by the body at that stage. So so look at the dosage. July 10 started 30 capsule, okay, consume 2 or 3 times daily. So 2 months later, September 2010, she actually started with together Ganoderma and pollen. So the YK1 actually reduced 20, okay, but take together with the pollen, and also consume 2 times daily, and continue until June 2016. Okay, then from there continue with the dosage of 16 capsules of YK1 and 2 sachets of pollen. She had been consuming this all along. Now she is taking 16 capsules of YK1 and 2 sachets of YK pollen daily as a maintenance. She is now in remission state as per so-called today. So this is under CT SIM, one of the customer. Okay, yeah, next. Now we look at the other product from Shuang Yongtian pollen. So pollen is having the most so-called complete type of nutrient that our body need. 16 vitamin, more than 16 vitamin, more than 16 mineral, and 21 amino acid, 28 nucleic acid, and 94 enzyme. All these are the body needed nutrient, especially during chemotherapy. And the function is to regulate nutrition imbalance, okay, fortify our immune defense also, and enhance the absorption of Ganoderma Lingzhi. Next. So fiber and lactoberry is also very good during this stage. Actually, fiber promote peristaltic movement in the intestinal tract and soften the feces. So lactoberry is a probiotic, actually very good to promote the so-called the balance of the bacteria in the colon and intestinal area. Next. So next is soya protein powder. So isoflavone is one of the unique group of phytoestrogen in plant, subduing growth of tumor cell and preventing cancerous disease. Actually, for this so-called isoflavone is looks similar to female sex organ, so-called the estrogen hormone. It actually acts like a weak estrogen, meaning that when you have this weak estrogen provide in the body, the so-called the cancer cell with the estrogen positive will actually occupy this weak estrogen. So when you produce more estrogen in your body, this will not actually cause any problem, because this so-called the cell already occupied with the receptor with this estrogen, so that because of a weak of this estrogen, it will not actually grow for the cancer cell to continue to grow as fast. So estrogen is important for this normal so-called physiological function, but high level linked to the increased risk of breast cancer. That's why when this protein powder able to provide weak estrogen, your cancer cell will actually, the receptor for this will actually take this and occupy it. So you will not have any more space to actually capture your existing strong estrogen from your body. Yeah. Yes. Yeah, I think that's all. Next. So for soya bean, for this so-called soya food and cancer prevention, they actually found that country that consuming soya food have less breast cancer. So this is a statistic, okay, in general that they found out from different country. For example, United States, they have the so-called the highest breast cancer rate, because they found that they don't consume much of the soya intake as compared to Japan and China, Korea, and Hong Kong. So they so-called, I believe that people who consume soya food have less cancer, in particular the breast cancer. So in Singapore, they found that 55% lower breast cancer risk if you consume more of the soya food. And also, this consuming of this soya food is good for colon and rectal, reduce the risk by 80% for colon and rectal cancer. This is a study in Japan. As for stomach cancer, it's actually lower, 40% lower in China. So lung cancer, they actually cut risk by half. This is a study in Hong Kong. As for prostate cancer, it actually found that tofu diet most protective, and this is studied in Hawaii. So in fact, soya food is they provide a lot of good benefit. Okay, if we consume enough for our body needs. Yeah, next. So conclusion, cancer is still one of the most dreaded disease, and Ganoderma is one of the best health food to prevent and also complement the treatment on cancer. So Ganoderma enhance our body immune system. So as we say, immune system need to be regulated. So the use of Ganoderma together with surgical removal, chemo, radiotherapy, in fact, is effective in improving the overall condition. So other Shuang product can be consumed as part of a balanced diet formula. Yeah, with that, I end my presentation. Thank you, everyone.